August 2025. Indian researchers published one of the best designed studies on the efficacy of topical dutasteride compared to oral finasteride in men with androgenetic alopecia. The results of this study could mark a before and after in hair loss treatment. If you're subscribed to my Spanish channel, you probably know that I've already covered the topic of topical dutasteride in different videos where I explained that its use currently doesn't make sense since the dutasteride molecule is too large to penetrate the skin. In one of my last videos, I explained how different topical dutasteride formulations are being studied with the goal of getting the drug to penetrate the skin. Well, one of those studies has just been published, and this could change everything. According to the 500 Dalton Rule, for a compound to be effective in topical or transdermal therapies, its molecular weight must be less than 500 Daltons. The problem with dutasteride is that its molecular weight is 528.5 Daltons or grams per mole. Yes, a Dalton is the same as a gram per mole. Therefore, the dutasteride molecule is too big and doesn't penetrate the skin well, unlike the finasteride molecule whose molecular weight is 372.5 Daltons. In fact, the 500 Dalton rule is why you could theoretically make a homemade topical finasteride formulation, for example, by grinding finasteride pills into a bottle of topical Minoxidil, but it wouldn't make sense to do the same using dutasteride pills or capsules. Therefore, until now, when a person considered using a topical formulation to replace oral finasteride or dutasteride, the only real option was topical finasteride. We have different studies that have analyzed the efficacy of topical finasteride compared to the oral version with positive results. For example, a phase 3 study from 2022 where 0.25% topical finasteride was shown to have a similar efficacy compared to the oral version of the drug in terms of increasing terminal hairs, but with a smaller systemic impact. Or this other study from 2015, which showed that after using 1 mg of oral finasteride for 2 years, it's possible to maintain the gains by using a topical finasteride concentration as low as 0.1%. The thing is, topical finasteride may have its days numbered. As I explained in my video on the ranking of the most effective treatments against androgenetic alopecia, oral dutasteride is the most effective drug available on the market, with oral finasteride being an effective treatment but not as potent as dutasteride. Common sense makes us think that if dutasteride could be absorbed through the skin, it would be more effective than finasteride. And this is where this phase 2 study published in August of 2025 comes in. It analyzed the efficacy of topical dutasteride against oral finasteride in 135 men with androgenetic alopecia. This is a randomized, double-blind, placebo-controlled study, the highest possible quality study, so we're off to a good start. Specifically, the study used 3 concentrations of topical dutasteride, 0.01%, 0.02%, and 0.05%, which were compared against placebo and against 1 mg of oral finasteride per day over a period of 24 weeks. According to the results of this study, patients who used oral finasteride and 0.05 topical dutasteride obtained the best results, with 0.05% topical dutasteride being significantly more effective than oral finasteride in increasing the terminal hair count in the vertex after 24 weeks. Regarding hair thickness, again, the finasteride and 0.05% dutasteride groups obtained the best results and were the only groups that obtained statistically significant better results than the placebo group. In addition, topical dutasteride showed a dose-dependent increase in hair count and hair thickness, with a 0.05% concentration obtaining the best results. On the other hand, according to the patient's self-assessment, they showed greater satisfaction with the use of 0.05% dutasteride than with 1 mg of oral finasteride. As for side effects, while oral finasteride caused moderate changes in serum testosterone and DHT levels, topical dutasteride only caused small changes. This suggests a smaller systemic impact and therefore a lower probability of suffering side effects such as sexual dysfunction. This makes a lot of sense since it's exactly the same thing the studies that have compared the use of topical finasteride against oral finasteride suggest. Finally, the topical dutasteride formulation was well tolerated and participants did not report significant skin irritation or side effects. The authors of this study conclude that 0.05 topical dutasteride is a more effective and safer treatment than 1 mg of oral finasteride for the treatment of androgenetic alopecia, since it's demonstrated a greater efficacy without having significant systemic effects. In addition, the authors of the study conclude that the phase 3 clinical trials with a larger and more diverse population are needed to confirm these findings. As you can see, these results are promising and suggest that we might be on the verge of the first topical dutasteride products coming onto the market to treat androgenetic alopecia. However, it's crucial to look at the fine print of this study, as there are a couple of important details that we should consider. But first, if you're enjoying the video, hit the like button and subscribe to the channel. First, we have to talk about the conflict of interest in the study. This study was funded by Shilpa Medicare Private Limited, an Indian pharmaceutical company that provided the dutasteride solutions analyzed, and the work done is directly related to a patent that has been granted to the company for the creation of topical dutasteride formulations. This in itself is not necessarily a bad thing, since, as I told you at the beginning of the video, due to the molecular weight of dutasteride, there are different investigations being carried out to obtain a topical dutasteride formulation that can penetrate the skin. Another problem with the study is that the authors of the study are employees of Shilpa Medicare Private Limited. In summary, the results of this study were obtained by scientists that work for the same company that funded the project and that owns the patent for the product being investigated. As you can see, the conflict of interest is clear. This does not mean that we have to disregard the results of the study, but we must emphasize the need for more independent studies that analyze this formulation. Another point that we should highlight is that the quality of the photos of the patients in this study is really bad, and it's really hard to assess their evolution over these 24 weeks. On the other hand, another really curious fact from this study is that while topical dutasteride did not have a significant systemic effect, the oral finasteride group obtained a 20% increase in testosterone levels, but only obtained a decrease in DHT levels of 25% after 12 weeks, which dropped to only 11% after 24 weeks. This is really shocking, since the bulk of the scientific evidence suggests that the decrease in DHT levels with the use of 1 mg of finasteride daily is around 65 to 70%. This very small decrease in DHT levels in the oral finasteride group could explain why 0.05% topical dutasteride was more effective than oral finasteride. We thought that this is the biggest problem with this study, and this is what should make us question whether the efficacy of this formulation is really so high compared to oral finasteride, and whether this novel topical dutasteride formulation has really achieved the objective of penetrating the skin effectively. Finally, if you want to know why you shouldn't practice NoFap, since it could be dangerous for your health, you've got to watch this video.